Has anyone in the room ever heard of COPD? I want everybody to think for a minute that you walk from your living room to your bedroom and you cannot breathe. That you are so out of breath that you wear oxygen 24/7. That your chest stays so tight that you feel like you're having a heart attack every day. Try to imagine putting yourself in that position and visualize what your life would be like. That is exactly what people suffering with COPD live with on a daily basis. So today, I want to bring everyone some awareness of what exactly COPD is. Chronic obstructive pulmonary disease, or COPD for short, is a disease that affects the lungs, causing reduced airflow, which makes it hard to breathe. It is also progressive, which means it worsens over time. COPD can include emphysema, chronic bronchitis, or in some cases even both. Roughly 15 million adults in the United States have been diagnosed with COPD, while millions more who have it may not even know that they do. The causes of COPD are long-term exposure to things like cigarettes, smoking, dusting, secondhand cigarette smoke, and chemical fumes in the home and workplace. The symptoms of having COPD can include things like coughing, frequent respiratory infections, shortness of breath, tightness in the chest, and wheezing. When managing the symptoms of COPD, some things to consider are to quit smoking, to eat well, to live a healthier life, and to stay as active as possible, and get support from your family and friends. Unfortunately, you cannot turn back the time clock and get rid of COPD, but there are things that help you with this disease. Most people with COPD find that taking medications for them makes living life a little easier. Things like nebulizers and inhalers are two great things to have when being diagnosed with this disease, but it is key to know exactly how to use them properly to get the full effects of the medicine. They also have things like oxygen treatments, which involved breathing extra oxygen in through a face mask or through a tube just inside the nose. It is known to ease the shortness of breath and also to help people live longer with COPD. Other things like ventilation devices, injections of medicine, and even surgeries are also things to consider when having COPD. In conclusion, I hope that I have taught you some things that you didn't know about COPD and the effects that it has on people that have it. Does anyone have any questions? Thank you.